Kia ora koutou, good afternoon everybody. Last night we received notification that a worker at the Grand Millennium Hotel in Auckland, the managed isolation facility, had tested positive for Covid-19. The test was done as part of our regular routine surveillance testing, and the worker and their family immediately went into isolation at their home. We've since had the rest of the family tested. 3 have returned negative results and 1 is under investigation. That person returned a weak positive result, and further work is being undertaken to get to the bottom of that today. We've started the contact tracing process, and Dr. Bloomfield will have more details on that shortly. I do want to be clear that while this case is connected to the border, we do see it as low risk to the community. Contact tracing, further genome sequencing, and that's all well underway, and we'll update you when we get more information on those things. I want to stress that the result was picked up during surveillance testing, so this is the system working as we intended. The person concerned works in an environment that requires diligent use of personal protective equipment, PPE, and regular cleaning. From the contact tracing so far, we've identified that there's been very limited exposure. A final point to note is that the worker concerned remains asymptomatic. This all bodes well. However, we are not being complacent. We need to continue to move quickly to mitigate any potential risk to the public, regardless of how low we consider that risk to be. So it's a good opportunity for all of us to remember that our public health measures, alongside our border measures and our vaccination program, continue to be incredibly important. And everybody, as always, has an important role to play in our COVID-19 response. Things like washing our hands and sanitising regularly, whilst it's become a little bit of a cliche, this continues to be an important way for us to stop the spread of the virus. Coughing into elbows and, of course, staying home when sick. Using the COVID Tracer app to scan into all of the places we visit and making sure that Bluetooth is turned on. These are all things that every New Zealander can do to help us stop COVID-19 in its tracks. All of these measures will help us to protect ourselves, our friends and our families and our wider families from COVID-19. So I'll now hand over to Dr. Bloomfield for a bit more detailed information and then we'll take your questions.
Thanks, Minister. Kia ora koutou katoa. Just continuing on from what the Minister said, some further information about the positive case reported last night and the household contact who returned a weak positive result and remains under investigation. So today we are retesting that family member and are also running the whole genome sequencing on both case A and the second family member. We should have those results available later today. They will help us determine what, if any, link there is between the MIF worker to recent cases at the Grand Millennium Hotel. Since the 1st of March, there have been 8 cases of people in managed isolation at this hotel. It is our largest managed isolation facility, so there have been 8 cases. All were identified on day 0 or 1 of their stay, which shows the value of our day 01 testing, and of those, 5 were in that sort of 2nd or 3rd week of March, which is the time that we might have expected this case to have become infected if it's linked, as we expect, to one of these cases. Should note case A and the family member both remain asymptomatic. Case A was at work yesterday, wore a mask for the duration. There were 2 colleagues who worked closely with case A. Both are now in self-isolation, and the case did not work for the 3 days prior to yesterday. Auckland Public Health officials are supporting the family's welfare needs and are arranging or speaking with family members about moving to the Auckland quarantine facility. They're also working rapidly to confirm case A's likely infectious period. Case A was on fortnightly swabs, and the last surveillance swab was taken on the 4th of March. The case had also, as I think you're aware, received the Pfizer-BioNTech vaccine as part of our border worker vaccination program. The first dose was on the 23rd of February, and they had just received the second dose on the 16th of March. I have one confirmed location of interest. This is the Mount Roskill Countdown, which was visited briefly by the case for around 10 minutes on Saturday, the 20th of March. More detail will be provided on the website, the Ministry of Health website, and anyone visiting the countdown in Mount Roskill at around the time that will be indicated on the website, it's just been confirmed, needs to be alert for Covid-19 symptoms. If they develop those, of course, to stay at home, contact Healthline about getting a test. Any other new locations of interest associated with case A, or if we confirm the second case, will be notified as the information is confirmed. And just a reminder, the symptoms to be aware of course, are cough, fever, shortness of breath, sore throat, sneezing, runny nose, temporary loss of smell, and of course, as we've seen in more recent cases, muscle aches. Now, on vaccination, as noted, the new case had received both doses of the Pfizer-BioNTech vaccine as part of our wider vaccination program. It's in fact pleasing to see that this border worker, along with over 90% of other border workers to date, had been vaccinated. The second vaccine had been given just on the 16th of March. We know the vaccine is effective at preventing infection, preventing severe disease if a vaccinated person does become infected, and also there is emerging evidence for it preventing transmission. Now, full vaccination is classified as someone who has had both doses and 3 weeks apart, and a period of at least 7 days after their second dose. And that's when we would expect 95% of people to be protected, in other words, to be immunised as opposed to vaccinated. This issue of how effective the vaccine is at preventing spread or transmission of COVID-19 is one we are looking at continually. I spoke this afternoon to our Chief Science Advisor, Dr. Ian Town. There's intense work and reporting on this around the globe, and essentially the evidence has been updated daily. At this point, he says the key thing we should be taking away is this vaccine is highly effective at protecting individuals, and seems to be doing a good job of protecting people collectively when higher rates of vaccination are achieved, as we're seeing in a number of countries around the world. So it remains critically important for all of us to take up that opportunity to be vaccinated. There is now an online tool on the covid19.govt.nz website that allows people to look and get an idea of when it is likely they will be offered the vaccine. Further to the border-related case, the one we're reporting, and that case under investigation we've just talked about, there are 3 other new positive cases, all in managed isolation, and 1 historical case to report. So the rolling 7-day average of new cases detected at the border is 5. 1 case is recovered, so our number of active cases is 68, and our total number of confirmed cases since the start of the pandemic is 2,112. We've had a total of 41 historical cases since the 1st of January, and out of a total of 300 cases. On the laboratory testing, there were 2,754 tests processed yesterday, reflecting the Sunday volumes, and the 7-day rolling average is 4,438 tests. I think I'll leave it at that, Minister,